Welcome to the Java Cafe, Java fam. Good morning. Welcome to the Java Cafe, Java fam.
Good morning, everybody. Good morning. Today is Tuesday, March 7th, 2023, and you're here for another episode of Your Healthy Java, which is sponsored by the Massachusetts General Hospital, Office of Equity and Community Health. We are here this morning, and we are, is the right word, obliging? We are bringing you the information that you requested a few months ago. Cindy Diggs, who is our community engagement person for Your Healthy Java, and also Dr. Alabri, our medical director. We came and chatted with you about what you would like to see in the Java Cafe and what subjects. And one of the subjects that you all wanted to talk about was kidney disease. And so Dr. Alabri went to work. And though this is a humble brother, we have a world-renowned nephrologist, and he's going to tell us about that specialty in nephrology, which is basically the area of the specialty that deals with the kidneys and also some blood pressure things and electrolytes. I thank you, Dr. Alabri, for sending me some of that information this morning. But listen, we want to make the best use of this young man's time. Before we do that, I just want to ask you to do me a favor. I'll pin it in the comments right now. You know, we do things live and in living color. I need you all to fill out the survey. I put it in the comments and I'm about to pin it. But we want to make sure that we continually hear from you about how we're doing, what we're doing, what subjects you would like to hear about, and if Your Healthy Java is having an impact on your health. Your health matters, and that's why we're here with Your Healthy Java. So please go and take this survey if you have not. We are getting closer to my goal. We're only about 50% there, but we're doing better. So please make sure you go and take that survey, and I will pin it later in the comments, but it is there. Get your questions ready because we'll be able to check in with Dr. Williams about your questions. I will say that he has not examined anyone. This will be general information as we do for this segment. But without further ado, I would like to bring in the world renowned, and he'll smile and say, okay, I'm just Dr. Williams, but the world renowned, because I think it's important that we understand that we have some of the best physicians and caregivers and physician assistants and nurses and respiratory therapists, all the caregivers in healthcare. We try to bring you the best. And so without further ado, I would like to present to some and introduce to others, Dr. Winifred Williams. Thank you so much for being with us this morning, Dr. Williams. It is a pleasure and an honor to have you here, sir.
Jimmy, thank you so much for that kind introduction. As I said to you before, yes, I'm a kidney doctor, all the renowned piece. I'm not sure about all that stuff, but thank you so much for your invitation. And I'm just happy to be here with you on Java with Jimmy and your healthcare segment. And it's an honor for me to be on your show.
Absolutely, sir. As we do often, we ask our guests just to share with us you're in nephrology, and to share with us a little bit of your background and maybe end it around the area of why you chose that specialty and why it is a area of passion and helping people, particularly in this area, to be better and live a better quality of life.
Yeah, so Jimmy, some of your audience and may know something about kidney disease, and what I hope we can do today is cover a lot of the basics of kidney disease and why it's such an important disorder communities of color. But just to tell you a little bit about my background, I'm born and raised in the Deep South. I'm from Baton Rouge, Louisiana, and came up to Massachusetts when I was a wee lad from go to college here. So I went to Harvard as an undergrad, and then in college I got interested in immunology. That's the study of the immune system and immunology research. And I became interested in science and medicine, went on to medical school. In medical school, I was fascinated by kidney physiology, the function of the kidney, and combining that interest as an undergrad with immunological research, kidney physiology in medical school. I've put those together to become a transplant kidney specialist. So my focus is transplant kidney medicine. I see patients with advanced kidney failure prior to transplantation, and I have a large clinic post-transplantation, taking care of patients who've undergone a kidney transplant. And I would say that one of the shaping, I think, tenets of my experience has been the fact that if you look at disparities in medicine, which is also an interest of mine, there are deep disparities in the care and assessment of Black and brown people with kidney disorders. And so that's been the focus of a lot of my national policy work, looking at healthcare disparities in end-stage renal disease and transplantation.
Dr. Williams, thank you so much. It's interesting. I mentioned to you that I worked at MGH in the consult psych service, but also kind of did some support for the psychiatrists that needed to see patients as part of the transplant process. And so there's definitely some correlation there and just familiarity with that. You talked about your switch from immunology into looking at the physiology of the kidneys. And so fascinate us, sir, and tell us about the function, because a lot of people may just attribute the kidneys as just a filter. And then most of the time, and thank you for being very transparent around communities of color and disparities, we don't really think about kidney disease until we hear that somebody's on dialysis.
Yes.
And so
Yes.
can you tell us about the kidney, make the kidney our friend, and fascinate us so we can be fascinated like you were?
Yeah, well, thank you, Jimmy. That's a great way to I think, frame that question. Most people really don't know what kidneys do, even where they're located in the body. But let me start here. So our bodies are made up of about 70% of water. Water. And
Yes.
so
That's
water
why
is
we need to drink
critical.
it.
Yeah, water is, and I'll come back to that. Water is critical for survival. You can live many days without food, but not so many days without water. So, in terms of water balance in the body, the kidneys are critical organs to maintain a water balance. They are critically important in terms of controlling not only water balance, but electrolytes and minerals in the body. And so they're really important organs. There are two of them in each individual by birth. There are two bean-shaped organs that are located in the small of the back on either side of the spine. And they receive blood flow from the arteries that course through the lower abdomen, the large artery called the aorta. And they have blood flow taken back from them to the inferior vena cava. That's a large vessel taking blood back to the heart. The working part of kidneys contain about 1 million little filters in each kidney, and they're called glomeruli. They filter the blood, wastes, and toxins in the body. And so if you look at kidney filtration, about 180 liters of blood a day are filtered, pass through the kidneys, and are filtered by these glomeruli. And that's about 50 gallons of blood a day. Yet we make only about 1 or 2 liters of urine a day. And so the system is incredibly efficient. Once the filtrate passes through the glomeruli, there are tubules that course through the kidney that continue to chemically convert that filtrate to urine, and that's what you excrete from the body. So it's a really elaborate, actually elegant system. In addition to the filtration portion and urine formation, the kidneys are also important in terms of their endocrine function. So they secrete hormones that, again, regulate minerals and electrolytes such as calcium and phosphorus. Very important for bone health. The kidneys are the site of vitamin D formation. That's also important for bone health and immune function as well. And also, I would just point out that the kidneys secrete hormones that regulate blood pressure as well as red blood cell formation that can prevent the disease called anemia. So they have many functions, and they are critical organs for life support and survival.
I mentioned to Dr. Williams early on that, he may say something that causes me to get what Dr. Alabre calls an uh-oh moment. And again, it is just so amazing to hear. And thank you for breaking that down in as much of a layman's terms as possible. And so my understanding from you, to break it down even more, our kidneys are a filtration system that are important to basically every function of the body, correct? Because you said 180 liters pass through the kidneys every day. So it cleans all the stuff that, we may not do well, with eating and
Yep.
certain things. And so, and thank you for kind of correlating the endocrinology piece with
Yes.
the kidneys, because a lot of times there may be some ambiguity around kidneys and the pancreas in relation to diabetes. You know what I mean?
Yes.
Because there's also this correlation with a lot of folks that we hear, they got the sugar. A lot of times a good portion of them wind up on dialysis.
Yes,
And
indeed.
so, it varies as to the reason why. So thank you for letting us know why the kidneys are important and what they do. And so you mentioned water. Off my very entry level familiarity, drinking water, I know, is vitally important to the kidneys. How do we take care of our kidneys and maybe get ready to get into the conversation of preventing types of kidney diseases? And we'll talk about the types of kidney diseases.
Sure. So I have 5 tips to keep your kidneys healthy.
Okay.
Uh,
I'm going to try to keep up with you and put them on the screen as we go.
and tips, I say 1, 2, and 3 are all just one tip. Drink more water. So if you take nothing else away from our session today, it should be that hydration is key. Most people actually just don't drink enough water daily. Often, what you find people, I'm busy. I'm moving around. I'm walking around. When you're on the consult service, Jimmy, at the Mass General, you're pounding the pavement day in and day out. You're not taking a water break. So most people don't drink enough water. What is enough water? Well, it's about 2 to 2.5 liters a day. I'd say on the order of 65 to 85 ounces of water daily. And here's some tips. Upon waking up, most of us go straight to Jimmy with Java. You want to have that coffee in the morning. But before you go straight to coffee, you want to wake up and drink a large glass of water. And so you begin your day hydrating. And that gets your day off to in the right direction. And then you can have your first cup of coffee. Often people, when they're relaxing and go after you've had a long day of work and you're on your way to dinner, you may have a drink or a cocktail. You may drink a glass of wine. When you drink a glass of wine, drink an extra 2 glasses of water with that wine. Why? So both coffee and alcohol are substances called diuretics.
Yes.
They increase fluid urine flow because of their diuretic activity. Alcohol and coffee interfere with hormones that cause the body to reclaim water, and so there you have an increase in urine output as a result of the diuretic action of alcohol and coffee. So I would say even in the morning and when you're having dinner, if you have a glass of wine, staying hydrated is critical. I'll give you one more tip, and we come back to the tips perhaps as we move through the show. I have about 5. The second tip I would say is eat less salt. Salt causes fluid retention, and that has to be eliminated by the kidneys. High salt levels can drive high blood pressure and heart disease, can lead to heart failure. And I have some tips in terms of how to avoid salt in your daily diet.
This is, I don't know if you notice, I've mentioned to you, I can be a little animated at times. We talk often, and you all put in the comments, so Dr. Williams knows I'm not lying. One of our audience members, Quincy Roberts, often, and there you go, being the example. Drinking my cup of coffee. We often talk about the importance of drinking water. We move in the space of trauma, and to be very blunt, Courtney Gray, a young man that taught us about trauma, said that in situations, and let's maybe deviate for about 30 seconds, Black and brown folks deal with a lot of trauma, and toxins build in the body when
Yep.
you were going through different types of anxiety and cortisone and all that stuff. And so we often talk about drinking water. I am very transparent that I am trying to do better. I'm one of those, if it's not in one of those fancy little, you know how everybody got the cups and whatnot, that
Jimmy, I'm right with you. I don't drink enough water, so I'm working on it too.
okay, so it's good that we're here together. It's not just me. And so we learned about what the kidneys do, what they are, where they're located. Also, some extra functionality that they have in relation to other systems in our body. And then we also learned some preventable tips, and I just want to review them for anyone. Just to remind you also, we're going to take questions, general questions, in about 20 minutes or so. But it's important to drink more water. And now this, Dr. Williams, I try to be intentional about putting water on the nightstand at night, and then really making it the very first thing I do in the morning. And I always don't do so well. As someone that drinks coffee and has a little drink here and there, for every cup of coffee or alcohol, drink two glasses of water for every cup or glass of either, and eat less salt and salty foods. If you would like to go there now, because within our community, we tend to season food a lot, and often we don't realize how much sodium and salt we're putting in it. So if you wanted to kind of stay right there for a second, when you mentioned a tip about how to decrease salt in your daily diet, please share with us, sir.
Yeah, so I think all really great points that you're emphasizing and reinforcing here, Jimmy. So I would say that a first principle and a first step, I would say, is don't add salt when you're cooking. Use other seasonings. Be creative. Stock cubes, herbs, spices, ginger, lemon. Use different sources of flavoring to spice and flavor your food. You should avoid breads and breakfast cereals that contain a lot of salt. So that means you need to know what the packaging materials say. Read your packaging inserts and the boxes in terms of salt content. I would say avoiding smoked meats and packaged meats. For example, packaged ham has a lot of salt. Now, I know there's going to be some pushback here because
I literally
you know
2 minutes ago, I was like, come on, let's keep it real, Dr. Williams. Let's address the pushback.
Right. Yeah, and I would say that you have to be careful about using less sauces that are really high in sodium content. For example, ketchup, mustard. I mentioned canned foods already. Low salt substitutes can do a good job in terms of keeping the flavors that we're accustomed to, and helping us to enjoy our meals. If I add another 3 points, you should eat less animal protein and more plant-based protein diets. So animal protein is broken down and eliminated by the kidneys, including the toxins that occur with animal protein. And there's an obligate acid production that's also eliminated by the kidneys. This just increases the workload on kidneys. And this is especially true for patients with some degree of kidney insufficiency. So I would say in this category, try different good sources of protein, for example, salmon, haddock, trout. Omega-3 fatty acids are rich in salmon and these fish foods. Fish is a good source of of animal protein that's more healthy for you. Turkey or chicken. Cook more food at home and less fast food, and plan ahead. And you want to make healthy food choices. And that's especially true, I think, in communities where there may be food deserts
Yes,
and
sir.
less access
Yep.
to healthy foods and selection, vegetables and fruits, it's important to be intentional about your diet. And so the last a couple of pointers are more challenging. Again, fitting this into our busy routines daily, exercise more often, 4 to 5 times a week. Only 15 to 20 minutes is all you need during an exercise session. Why is this important? It keeps your heart health in the right direction, the blood vessels healthy, and generally it increases blood flow through the body, through the kidneys, and this is an important, a habit to build into your routine. And finally, the most challenging of all,
Uh-oh.
try, and I think, Jimmy, you've done this, try to avoid gaining weight. So, weight is a major issue in our communities of color. A weight gain can lead to type 2 diabetes really at an adolescent age, early on. You want to decrease the portion and sizes of your meals. You want to try, if you have a really big meal, you've had, say, some overeating, you might try fasting for 16 hours after that heavy meal. So I think trying to do what you can to deal with weight gain is really important.
Absolutely. Thank you for your vote of confidence, sir, because I wasn't one that gained the COVID-15. My weight gain has happened within like the last year. And that's a whole nother conversation. But I just wanted to say, Dr. Williams, that you we the healthy eating, the drinking water, one thing we didn't get into, and I'll ask you real quick, because these are sort of three central things that when we talk about prevention and proactive and routine and preventive healthcare, is also sleep. How
Mm.
important is sleep to our kidneys? We know, overall health, but let's be specific in this space. Is sleep one of the three that help with the healthy eating as well?
This is a whole nother segment, and you may want to have a sleep specialist come on, but sleep is important for a whole range of functions, including your mental and emotional health. Yeah, in terms of stress and trauma in our communities, getting a good, a full night's sleep is really helpful in terms of decreasing the level of daily anxiety, just remaining healthy in terms of your emotional outlook and how you anticipate and deal with the kinds of challenges you encounter day in and day out. Sleep is important for immune function. Sleep is important for healthy neurological function. Sleep is important in terms of studies that show that if you're sleep deprived, that actually lessens your lifespan. So, in terms of survival benefit, sleep across the board of a range of indicators is an essential, I think, health goal to achieve.
Absolutely. We it's funny because in real time, I just thought about the three. Every guest that we've had from MGH, when we talk about routine and preventive healthcare, being healthy, whether it's heart health, kidney health, eye
Yes.
health, or whatever, the three are eating right, drinking, exercise, and so it's actually four. Those four central things. And so that keeps being reiterated. Folks, I see your questions. We're going to ask them in just a few moments. And so, Dr. Williams, we talked about ways of preventing and keeping our kidneys healthy. Let's unfortunately talk about what could possibly happen if we don't hydrate, if we don't take care of ourselves, but specifically, what are some negative outcomes of that pertains to the kidney?
Yeah. So I'm going to go back and talk about some of the indicators
Okay.
of kidney health. And I think this is a really important segment. Let me just say this. Um, and this may come up in our Q&A session, Black and brown folks, and if I just look at African Americans as a case in point, the overall incidence of end stage, that's advanced kidney failure, is 3.5 to 5 times that of white individuals. So that's a disproportionate burden of chronic kidney disease in the Black community. If you look at the dialysis population in the United States in terms of health disparities, and this is health disparities information. There are about 700,000 patients on dialysis in the United States. Fully a full third, 35%, 35 to 40% of those individuals are African American. So that's a huge burden of kidney disease in our communities. And we can come back to the reasons why and why health disparities are so important to address. But those are factoids that I wanted the audience to be aware of. If you look in the broader picture, about 1 in 10 individuals, about 10% of the US population has kidney disease. And most individuals with kidney insufficiency don't realize they have that problem. So in that regard, it's a silent disorder. We call it a silent killer because unless you have preventative, screening to know that you have a kidney disorder, you're completely unaware of it. The two main causes of kidney failure in the United States are diabetes and high blood pressure. Those two, diabetes and hypertension. And again, they disproportionately affect Black and brown people. And that's a key point that we have to drive home. The other causes of kidney disease, autoimmune disease like lupus, there can be genetic predisposition to kidney disease, infection, even medications, non-steroidal anti-inflammatory drugs, if they're used to excess, can cause kidney insufficiency. And so one thing I want to get across is the patients, I say, generally are unaware that they have kidney disease. You should, next time you see your physician, your primary care provider, you ask, how is my kidney function? You should know that. How is my kidney function? And a simple blood test.
Can I ask you the name of the test so they know specifically which one to ask?
Exactly. I'm going right there with you, Jimmy. A simple blood test to give an indication of kidney health is called the serum creatinine. Creatinine, creatinine. Serum creatinine is a byproduct of muscle metabolism. I can repeat that, Jimmy, if you like.
Yes, you saw my face.
Okay. CRE.
Yep.
ATININE, creatinine. CREATININE. The serum creatinine is a byproduct of muscle metabolism. It's a breakdown of muscle metabolism, and creatinine is filtered and reabsorbed filtered by the kidneys and reabsorbed in the kidneys to a stable level. So a serum creatinine of about 1.0 is normal. We use the serum creatinine to estimate what's called, and this is kind of a big term, the glomerular, I told you about glomeruli, the glomerular filtration rate, the GFR. Some of you may have heard about GFR. The estimated GFR gives you an indicator of kidney performance. A normal GFR is 100 cc's per minute. When your estimated GFR, call it eGFR, falls below 60 cc's per minute, then we determine that you have some degree of kidney insufficiency. If the GFR gets down to 30 cc's per minute, you can call that 30% of kidney reserve. That's moderate to advanced kidney insufficiency. When it gets down to 10 to 15, then you have end-stage renal disease. And that's a time when a patient needs to prepare for kidney replacement services, either dialysis or transplantation.
It just, the correlation between, when you mentioned the two top causes in the United States of high blood pressure and diabetes, I said early on that often two things. One, and it's often said here, there are a lot of, I've never heard kidney disease being referred to as a silent killer. I've often heard either heart disease or high blood pressure. Hypertension. And so the correlation between diabetes, high blood pressure, and kidney disease in Black and brown communities is just ridiculously scary.
Yeah.
And that is just, again, I can't reiterate this enough. This is why we have this segment and why we're starting to talk about and push this thing of Your Healthcare Matters, because let's go a little bit back into, so a blood test can prevent it. It can give you sort of what we call a baseline of where you are, and you want to ask specifically for the serum creatinine test when you go to your doctor to get sort of a baseline. If you're not drinking a lot of water. Can I ask a very interesting question? Lower back pain, sometimes on the right and left side. I've heard different things about that you might want to, if you're having that pain often or whatever. Is that it? indicator? Is it a slight indicator at all for someone that knows they're not drinking water? And
Yeah, I would say, Jimmy, back pain in general, low back pain generally is, I would just tell you, is probably more likely musculoskeletal
skeletal,
or
yeah.
orthopedic in origin.
Okay.
It's rare that kidney disease initially manifests itself as back pain.
Okay.
That would be unusual. If you have a recurrent urinary tract infection and that
Yes.
urinary tract infection courses up into the kidney, that's called pyelonephritis. That's an infection in the kidney proper. That can lead to back pain. If you have kidney stones, you can certainly get back pain as a result of kidney stones and obstruction because of stone disease. But again, stone disease is fairly uncommon. It's not a common cause of early kidney insufficiency. So that wouldn't be one of the first signs of a kidney disorder.
Okay.
So, what are the indicators of kidney insufficiency? Again, in that early range where you have the opportunity to intervene, it would be a serum creatinine. And another biomarker that's important is the amount of protein in the urine. So, getting a test for protein in the urine, which is a simple test, as well as a serum creatinine, those are key indicators. If you have an increased level above normal, because there's a normal low level of protein that's excreted daily in the urine. If you have a high level of protein in the urine called proteinuria, that's an indication that the filtering elements, those million glomeruli in the kidney,
Yep.
somehow have been damaged.
And they're
And
not
so,
extracting the protein or breaking down.
exactly, they're not keeping the protein back there, allowing it to see it sieve through. And if you're leaking protein in the urine, your filtration, your filters are somehow they've been damaged, and that's an indication of a kidney disorder.
It's at least one out of every 4 episodes. I'm sitting here like, okay, I'm about to call my doctor, and so this is Dr. Williams. This information, though, is good for us to have the information. I hope it mobilizes folks to pay attention next time they have a physical. Call their doctor, ask for the serum test. Also, ask for, is there a name of the test for, or when you have a urine test? Are these standardized?
Your doctors will know. Your doctors will know. There are a couple of different types of tests of protein in the urine. One is called, it's another long term, microalbuminuria, microalbumin.
Okay.
Microalbumin is another test and early indicator of a possible kidney disorder, especially in patients with diabetes. They should have a microalbumin test in the urine done at least yearly, annually. So I would say that the starting point is to get a serum creatinine and an estimated GFR. Protein check in the urine would be an additional test, but that set of biomarkers, if you will give you a good idea of your kidney health.
Dr. Williams, this we might need a part 2 with this, because there's so much information that you shared with us. It's just so interesting, and
So,
just
before we go to questions, Jimmy, let me just say one other
yes,
piece, if I could add one.
yes,
So, some people, what are the common symptoms and signs of kidney disease?
yes, sir.
And I already said, unless it's pretty far advanced, you don't really see a sign in your own health. But you may begin with advanced kidney insufficiency to develop fatigue, weakness, difficulty concentrating, poor sleep, sometimes even confusion with a very advanced kidney insufficiency.
Okay.
You may have a loss of appetite. You may even have nausea and vomiting, a metallic taste in the mouth. That's a sign of very advanced kidney insufficiency. A little bit lower, I would say, a production of urine output daily with swelling in the legs or swelling around the eyes. That's called peripheral edema,
Yep.
EDEMA, and periorbital edema, swelling around the eyes. You may develop high blood pressure and heart failure because of the inability to eliminate fluid from the body. So that's a body that's overloaded with salt and water, and you can see that manifest by edema and heart failure.
This is as informative as it is. I'm kind of cringing because all of these things that you've named, I remember just growing up, and these are, and I say this sincerely, putting together why some of our older and elder family members who may have been technically obese. You talk about the edema, which it means swelling, you know, to us, you know, as young people, we go and like play with it and whatnot, and really not knowing that
Right.
our family members, you know, were sick. And so again, it's just with the disparities, with the food deserts and whatnot, with all the inequities that come within
Yes.
the healthcare system. It is just interesting. Last, before we go into questions, treatment, sir, at the worst, and I think we've only pointed to. I think you've already pointed to two. I don't know if there are more. If there are any pills, you know, by mouth or anything, but um, at the worst case scenario, transplant and up and until dialysis. Are there any other treatments?
So, if you catch kidney disease early, for example, in a patient with type 2 diabetes and obesity, for example, you want to make sure that there's tight control of diabetes. So, tight glycemic or tight sugar control, control of the diabetic um, um, milieu, as we call it. So, you want to make sure that levels of sugar in the blood are well controlled, either by oral hypoglycemic medications or insulin. So you want to make sure that your diabetes is well controlled and that you're really working closely with your primary care and other providers to make sure that diabetes and your blood pressure are well controlled. So hypertension, uh, con- good control of hypertension, good control of blood pressure targets, good control of diabetes is key. There are medications, and we can get a little bit, it can be a little bit complicated when you talk about angiotensin converting enzyme inhibitors, ACE inhibitors, angiotensin receptor blockade. There are drugs that target the kidney to decrease the amount of kidney work, and you would use those really early on to save and preserve kidney function, and they've been shown to be kidney protective. So an ACE inhibitor or what's called an ARB, those agents are used commonly to try and lower the amount of work in addition to lowering the blood pressure systemically in the body. There are other agents too, but these need to be deployed with, the care and attention of a nephrologist or a primary care doctor.
Again, Dr. Williams, this is, and I think we'll be able to squeeze most of the questions in, but I have a few myself just based off of my familiarity with, you know, being minimally entry level in medicine. Um, Pastor Marion is asking, I think she's asking, are there some medications that have an effect on the kidney?
Yeah, so this is a really important question. Another one of the preventative measures. So the so-called non-steroidal anti-inflammatory drugs, NSAIDs, these are used typically to treat arthritic pain and other ailments, uh, um, arthritis. And what are these drugs? Aleve, Motrin, ibuprofen.
Yep. Yep.
Those are non-steroidals. If you use them in very high doses and regularly over time, they can cause kidney damage, especially in patients with some degree of kidney insufficiency. So, in patients with even moderate or mild to moderate kidney insufficiency, we say use those drugs, NSAIDs, judiciously. You have to use
Yes.
them in small amounts to alleviate pain and treat your pain, but you don't want to overdo it. So NSAIDs would be one of the nephrotoxins that one would avoid. There are certainly antibiotics. There's certain other drugs too that have an injury effect on the kidney that need to be avoided. But again, you can do that in consultation with your physicians.
Absolutely.
Jimmy, you raised the issue about what's the best if you have advanced kidney insufficiency. That is, the GFR now is coursing down around 10 to 15% of kidney reserve. What's the best kidney replacement therapy? If you are judged to be a healthy candidate who could endure The surgery that's attached to transplantation, transplantation is really the ideal, the gold standard for kidney replacement therapy if you can enjoy that opportunity. It's physiologic 24/7 kidney replacement therapy by an organ now that's implanted in the recipient's body that now takes over the work of the failing kidneys. It causes an increase in longevity because dialysis, which is the other option, and there are two forms of dialysis, we can talk about that. Dialysis only replaces about 10 to 15% of kidney function. And that's really, although you get dialysis, for example, if you're on a hemodialysis regimen, every day, other day, you have a 4 hour dialysis session in a freestanding dialysis center, Monday, Wednesday, Friday, and then you have a break on the weekend or Tuesday, Thursday, Saturday. That gives you only 10% of kidney replacement. When you have a transplant, and you can realize an opportunity, and there's a health disparity there too for
Yes.
communities of color.
Yep.
You have 24/7 physiologic kidney replacement, increases your quality of life, allows you to have be freed in terms of your dietary restrictions, your travel restrictions. You're not wed to a dialysis machine, and it increases longevity.
I'm shaking my head like this. I was the caregiver for my grandfather for the last 5 or so years of his life. And I remember from having to make sure the walkway was cleared, during the snow because they wouldn't pick him up if it wasn't clear, to
Yep.
times they took too much fluid off of him.
Yep.
Push him up the stairs because he was so weak. It is so interesting to hear because by presumption, though not 100%, I did not know dialysis was only giving 10 to 15% of what a healthy kidney would give the body. So
Yeah,
that,
and it's a very gross kind of, I say this understanding that there may be some in the audience who are on
yes,
dialysis,
sir.
and want to be sensitive to them,
Absolutely.
to say that, it's a life-saving therapy. Without dialysis, you cannot live if you haven't enjoyed the opportunity or benefit of a transplant. So in that regard, it is a critical therapy. But again, you're guessing about fluid removal.
Mhm.
And you're taking a lot in one session. So if you take too much, your grandfather is going to come out of the dialysis center with a low blood pressure,
Yep.
feeling washed out,
Yep.
taking a full another day to get back to normal. And then the next day you got to go back to dialysis. So, it's kind of a difficult road for lots of patients. Some patients do just fine. And there are different forms of dialysis. One is peritoneal dialysis, where we introduce a catheter into the abdominal cavity.
The
We
fistula.
run a fistula is for hemodialysis.
Okay.
That's where you have the blood is taken out of the body and run through a computerized machine for 4 hours at a time and given back to the patient. And the electrolytes are corrected. The fluid is removed during the dialysis session. Peritoneal dialysis is different in that there's a catheter that's placed into the abdominal cavity. The filtration occurs across the membranes in the abdominal cavity. You run in dialysis fluid, you drain it. You do that 3, 4 times a day if you're doing standard ambulatory peritoneal dialysis. Most patients get converted to what's called a cycler, a machine that runs that fluid in and out overnight. And you're being dialyzed while you're sleeping via the cycler. So when you get up in the morning on a cycler regimen, you're good to go.
Dr. Williams, this is, and I will own that this subject, I just realized, just made me very fond of memories of my grandfather. And so
Yes.
I just, I'm going to go to questions so I can just behave myself here. One of the things that Heidi was asking is, I think she was asking, is it true we should drink 2 times
The-
of our body weight as far as the water?
Yeah, I would say this, I wouldn't get that complicated. I would say what you want to do is drink on the order of 2 to 3 liters of water a day. That's a lot of water. 80 ounces of fluid a day is a lot. If you can, if you grab, one of these, you know, water bottles, you have on the order here of about, this is about 18, call it 20 ounces of fluid. You want to have 4 of these a day. You can really calibrate how much you take in a day, but I would say 80 ounces of fluid daily is fine. Really, regardless of your body weight.
Okay.
The kidneys are really fine-tuned to regulate the proper amount of water. What you want to make sure is that when you're, for example, going to the bathroom, when you pass urine, you want to make sure that it's not that deep yellow color because it's not diluted enough. When you're drinking enough water, really the urine is kind of a light color or even transparent. You don't want to have to necessarily have it always look like water, but you don't want to have it that deep color suggests that you're underhydrating and it's very concentrated urine.
That how do I? That's a sign. I know when I need to hop on hydration when that has
Right.
happened. We'll just leave that right there. Okay. So Tess is asking, does the temperature, good question, of the water matter? Should it be room temperature, warm or cold? My
Ne-
nutritionist has a thought about food and
yeah.
temperature when we put in the body, but tell us.
Yeah, water dynamics, not my forte. I
Okay.
would say wha- whatever floats your boat as it will. Mixing metaphors here. I would
Yep.
say you go for it. You just want to be hydrated. If you like warm fluids. I thought really that question would go to, should I have electrolyte fortified water?
So I was going to
Yeah.
ask about this whole pH
Yeah.
because I'm that guy. The name brand and the
You
pH.
know,
And
I would say if you have electrolyte fortified water, I think that's fine because again, what the kidneys do, they're finally regulating electrolytes. A lot of patients need to have more potassium added
yeah,
to their diets because, in fact, that can help with your blood pressure control. Interestingly, um, potassium can be dangerous in patients with very advanced kidney
right.
insufficiency
Yep.
because you can accumulate potassium uh, to dangerous levels, and that can interfere with the electrical activity of the heart. But if you have normal functioning kidneys, have at it.
Teresa, I think we answered this that there is a relationship between sleep, not sleep apnea, but I believe you said, Dr. Williams, that not sleeping
Yeah.
enough could be one of the
hmm
signs of your kidney not being
hmm
at its full potential.
Yeah. The relationship here is a little less direct, I would say. And what I mean by that, sleep apnea often occurs in patients who are really getting to very high levels of weight. So they're very overweight and even, as we say, obese. And if you have sleep apnea as a function of obesity, obesity in and of itself tends to lead to type 2 diabetes. Type 2 diabetes can lead to kidney insufficiency. So there's a link there, but it's a less direct link. I would say that sleep apnea in and of itself doesn't directly harm kidneys, but associated with the whole body metabolism that's a part of the sleep apnea presentation, those patients are prone to kidney disorders.
I got you. Miss Teresa has a couple other questions as well. All right, I'm going to go to one more of hers where she mentioned, when my mom had COVID, her creatinine level skyrocketed so quickly and it put her into end of renal stage renal failure. So is there, what did you see any, I mean, we know that COVID-19 had a lot of interesting impact on our bodies, and we know that on Black and brown communities, disproportionate impact. Um,
Um,
what,
this,
go ahead, sir.
yeah, this is a really important question, and the answer is yes. COVID-19 uh, uh, it can have a direct nephrotoxic effect, direct toxic effect on kidneys. It can happen via a couple different mechanisms, and this is still being worked out. One, when you have COVID-19 and pneumonia, and you have what's called sepsis, where
Yep.
your body's regulation of blood pressure is ablated, then you have very low blood pressure, you're in shock,
Yep.
and that decreases perfusion to the kidneys. That's acute kidney insufficiency because the kidneys are not being perfused. Many patients develop that in the early stages of COVID-19, the COVID-19 pandemic, because patients came into the hospital critically ill, they're ICU bound, they're intubated, they're on pressor support to try and support the blood pressure, and that was often associated with acute kidney injury basically is a function of what we call hemodynamics. So hemodynamic instability, low blood pressure, septic shock. There is some evidence emerging now that even as we've moved beyond the early stages, the early throes of the pandemic, there may be some toxic viral mediated effects, not only on the kidney, but on the heart. And so inflammatory kidney disease, inflammatory heart disease can be a function of COVID-19, which is um, the public health message here. Make sure you're fully vaccinated and make sure you have all of the run of vaccinations you need, including those that capture the Omicron variants.
Absolutely. That, and it's interesting because this platform was, they were calling me Mr. COVID because testing and vaccine, I got a lot of, anyway. Dr. Williams, I don't see any more questions. Oh, I do see one about what is the ideal generally, as Auntie Java, he hasn't examined you, and everybody, as we've learned, has a different baseline. Traditionally, what is that category? You know, when you get your blood test,
Yeah.
in the range,
So,
what's the range
yeah.
of good A1C?
First off, just what is an A1C? An A1C is a reflection of the body's level of blood sugar, blood glucose over about a 3-month period. So it's, in a sense, it's an ambient reflection of the level of blood sugar on a day in, day out basis. So when you get your A1C, you get it checked, and that should be a reflection of the prior 3 months. In general, it should be about 5.7 or below.
Okay.
That's a normal A1C. If you're diabetic and you have controlled your blood sugar level to the point where your A1C is in the range of, say, 6.2, that's pretty good. That's pretty tight sugar control. And that's an objective for patients with diabetes. The challenge for diabetics, especially patients who are insulin dependent, is if you overshoot and you have hypo or low blood sugars, that can be life-threatening. Even though a low blood sugar will correct your A1C, it can be life-threatening. You have to be careful not to overshoot.
Okay. Dr. Williams, one of my indicators of a awesome show is I'm tired at the end. Sir, I am pooped. Because I don't hear this information, and just there's family members, there's community, there's past, knowing of now, okay, this is why such and such, faced a demise or things like that. And so, Dr. Williams, I truly want to thank you. I want to big up the world renowned or your specialty, because as a man of color, as a Black man, I just want to celebrate that, because there aren't that many of you in spaces like this. So, sir, we honor all of your achievements and thank you for coming and giving back to community in this space. I'm sure that we will probably hear from you again. We try to vary the topics, but I'm sure folks, on the survey, you'll probably come up as one of the favorite guests.
If I can say this, Jimmy,
Yes,
it's a pleasure to be with you on the show today. I'm happy to receive questions from any in the audience. I hang my hat at the Massachusetts General Hospital. I'm the Associate Chief of the Renal Division there, and also the founding director of the Center for Diversity and Inclusion. I'm happy to hear from anyone in the audience. And I created that center 30 years ago at MGH.
So, all right, we're here to talk. And for the life of me, Dr. Williams, I had to text Dr. Alabre this morning because I could not think of the word renal. Traditionally, your specialty is associated with renal rather than nephrology. And so, thank you. I could not think of that word for anything. And anyway, thank you so much. And it's so interesting to know that you started the. So we're going to need to talk with you further, because we're going to do some other panels about health equity and whatnot. And I'm sure you know the name Leah Gordon, who did.
Yes, of course.
Yes, she's now at BC, running things over there in the DEI. Yes.
Jimmy, when I started, you should know this too, just historically. When I started, it wasn't that long ago. I mean, I don't think I look that old. It wasn't that long ago. When I came on staff at the Mass Journal, I was the first African American physician in the history of the hospital to be appointed to the Faculty of Medicine at MGH.
You're not going to sit up here and drop gems like this. Dr. Labre, if you're watching, and Natalie and all of y'all, if you all knew this, and Dr. Williams, I'll sidebar you later on this afternoon.
Okay.
Again, to honor your achievements in this space and that historical context.
Well, thank you, Jimmy.
Thank you. I appreciate
It's a pleasure being with you today.
Absolutely. Folks, they're excited and really, look, they want, Dr. Williams, we need your cell phone number, address, and any way to contact you.
Jimmy, you have that. I'll send it to you, and you can be their source. I'm happy to share.
Thank you, sir. I appreciate you so much, Dr. Williams, and we'll be in touch. Thank you so much, sir.
Great. You take care now.
Thank you. Folks, that was one of our most informative, engaging Your Healthy Java segments that we've had since the first Tuesday in November of 2021. Wow. 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 The other part of the wow is that information and knowing what our community deals with, from obesity to cooking with salt to, you know, I'll be honest, I had 3 bags of gummies this weekend, and I'm like, so but I will say, for me, Your Healthy Job has helped me because I don't eat chips as often. Gummies, I'm down to about 3 times a week. And I also know if I'm stressed out. So just to share with you all that these are some things that we just want to be aware of. If you know you got a crazy weekend coming or something's going on, my thing is, don't have them in the house. If I don't have them in the house, I won't eat them. If they're in the house, I'll eat them. So today was very, very good. Thank you all for your questions. Hey, Natalie, there is the information to find Dr. Williams' information there at Mass General. And Natalie is behind the scenes person there at the Office of Equity and Community Health there at Mass General. So it's good to see you in the room, Natalie. She probably usually pops over on Twitter, but good to see you on Facebook this morning, Natalie. But thank you all for tuning in this morning. Please hit share. Do not forget, folks, we need you to go in and fill out the survey. I'm going to put the link in the comments just by itself so you can get there easily. Your Healthy Java YHJ, I can spell y'all, survey 23. Please go fill out the survey to let us know how. Let me tell you, you fill out the survey, we bring you what you asked for. You all wanted to talk kidney failure and renal disease, we brought it to you today. So please go ahead and fill out this survey and let us know how. And Natalie, if I could put you on the spot, Natalie's on from MGH, and so we need to make sure that I get her this information about how we're doing. How about that? Everybody, I'm messing. Please go fill out the survey, and we shall talk to you tomorrow morning. Tomorrow morning, I have the opportunity to bring in some young women that are focused on equity around Boston Harbor. And so they'll be with us tomorrow morning. There goes Natalie. They'll be with us tomorrow morning at 9 a.m. And then on Thursday, I am going to have some guests. No, Auntie, the survey link is here. In the comments. It's not on Twitter, so you're able to take it through the link through here on Facebook as well. But on Thursday, we're going to have the family of a young man by the name of Justin Root, who the family has mentioned to me that he was killed by police some years ago. And they are having a action on Saturday at the State House around qualified immunity and things like that we've been talking about. So that'll be Thursday. But we will see you tomorrow morning at 9 a.m. With the Boston Waterfront Coalition for Waterfront Wellness Wednesdays tomorrow at 9 a.m. Again, please don't forget, do the survey. Go do the survey. Go do the survey. All right. We'll talk to you soon. Sister Debbie, thank you. The survey is quick and easy to fill out. Thank you, Sister Debbie. Sister Debbie, who would have ever, let me behave. Who would have ever thought Sister Debbie was one of the folks that kept me in line when I was younger? In my teens. It's just an honor to see you in and being a part of this, because you ain't fake or phony. You wouldn't be here. So I appreciate you. I was going to say sis, but I'm getting off of here. Y'all have a wonderful day before I get in trouble. I know Sister Debbie is falling out over there. You all have a wonderful day, and we'll see you tomorrow morning at 9 a.m. Remember, your health matters. Peace.